John Schmocker. I'm one of the surgical oncologists or cancer surgeons here at UT Medical Center. And today we're talking a little bit about minimally invasive or advanced approaches for cancer surgeries. I think a really unique service that we offer here at the Medical Center and the Cancer Institute that is a unique skill throughout the East Tennessee area. So
Dr. Schmocker, what are some of the services available?
yeah, so we have really expanded our offerings for minimally invasive cancer surgery, everything from operations on the pancreas for pancreas cancer to the stomach to even doing large removals of the liver using robotic or laparoscopic approach. And like I said, I think at least some, if not all, of these services are very unique to the Cancer Institute here when you look at some of the other centers in the East Tennessee region.
Great. Is there some advice, I guess, for patients who are interested in this, like how?
Yeah, I mean, so really when we talk about minimally invasive approaches, it's basically doing the same operation as the old-fashioned open operations, the large incision, things like that, but using cameras and small instruments. And the majority of those incisions are, 5 millimeters or so, and the bigger ones can be a centimeter or so. And really the big benefits of that is it really almost eliminates the risk of wound infections. Post-operative pain goes way down to the point where we're able to get people out of the hospital 3, 4, sometimes even 5 days sooner than they otherwise would be able to leave the hospital. And certainly when we're talking about cancer surgery, we want to make sure that we are doing a good cancer surgery, meaning negative lymph nodes, negative margins, things like that. So not every candidate not every patient is a candidate for a minimally invasive approach. It depends a lot on the anatomy and things like that, but it is something that we are offering quite frequently these days.
One question, I guess, from our audience is just about the, collaborative approach. Could you maybe share a little bit about that here at UT Medical Center?
Yeah, so when we talk about collaborative approach, there's a collaborative approach really for all of our cancer patients that includes basically tumor conferences where we have experts in every sort of cancer field that help establish really the best plan for each individual patient, how to sequence the care, meaning whether we do surgery or chemotherapy or radiation and what order we do those, and sort of how surgery fits within that. And it's a really collaborative effort. And even the patients that have providers outside the UT system, we're very facile with communicating the plans from our standpoint back to the local providers and really coming up with a comprehensive game plan for all of our patients. And then when it comes to the surgical approaches, we do a lot of these cases, several surgeons together and things like that. And we have a really robust OR team, and then our nurses after surgery are very involved and take care of a lot of patients that have big cancer operations, and we have a really good system in place. And whenever you're having a big operation like that, you want to make sure that everybody is used to it. It's not just what I do. A lot of it is what happens in the care afterwards.
Wonderful. Any advice, I guess, if somebody's maybe facing this sort of, or needing to make a decision, like what can you tell?
Yeah, I mean, certainly whenever anybody has a cancer diagnosis, the most important thing is that you find a place that you're comfortable with your care. And I send many of my patients for second opinions because that's really important. And so if you have a cancer diagnosis, I think it's really important for you to be comfortable with the team that you have, with the providers that you have, and none of us take offense or are upset with second opinions. It's a name of the game, and in fact, I encourage many of my patients to get second opinions. So.
Yeah, wonderful. Okay, anything else you want to share? I guess just about some of the surgical options.
Yeah, so I mean, in particular, there are many places that do some minimally invasive cancer surgeries. I think our offering has really expanded to the point where we're able to remove, for example, half of the liver or more with the camera and small instruments, and that's an operation that in the past would require a big operation under the rib cage. And patients are leaving the hospital 2 or 3 days after surgery whereas 10 years ago those patients would be in the hospital for 10 to 14 days.
But if you want to add anything else?
Yeah, so I think certainly if for those people out there that are listening, if you're unfortunate enough to have a cancer diagnosis, I think we have a really robust team in place, and we really focus on individualized care plans, and making sure that we're taking your needs and preferences into account when it comes to really all of your treatment. And so we're always happy to serve you, and would appreciate you coming to see us.